name is Sarah Ellis, and I'm here today to bring you a unique combination of physical therapy and personal training exercises to provide you with a balanced body to get you ready for your next tennis match and keep you playing for years. In the upcoming tennis video series, I'm going to have a unique combination of 10 exercises. Now, to go ahead and get you started today, I've got 3 prepared. So, the first exercise is going to help you protect your knees. The knees are the most common injury in the body, despite the age group, from little kids to age 80. So, in order to protect your knees, you need to help create stability muscles within the joint. So, the first exercise I want you to do is a single leg squat. Now, this exercise is actually fairly difficult to do correctly. So we're going to start with a few steps. The first step is to make sure you can do a regular squat. Now, for a regular squat, you want to focus on a couple things. First thing are your knees. You want to make sure your knees stay shoulder width apart and in line with your body. Now, common mistakes that I see are when people go to do a squat, they let their knees go in. This is really bad, tears up the knee joint. So you want to think about keeping your knees in line with your toes, like you're going to draw a line straight down to the ground. Okay, now, the other thing to think about that's important are your hips. A lot of people, when they go to do squats, they let their hips go forward and their knees go over your toes. When that happens, all the force comes out of the knee joint and it hurts your joint. Now, to do a squat correctly, you want to think that you're sitting back down into a chair. What this does is utilizes all the big muscle groups in the lower body and protects your knees. So then when you're out on the tennis court, all the correct muscles will fire and it won't stress the joints. Now, once you can do 10 squats, just like this, nice and easy without a problem, then you want to move on to the single leg squat. For the single leg squat, you want to think about the same principles. Knees stay straight in line with your body, hips stay nice and tight, down and back. Okay, just like you're sitting down in a chair. So, right here, single leg, hips straight, you want to squat down. So if you notice, my knee, when I go down for a squat, stays nice and in line with my toe. It doesn't go in. So you see how my knee's going in now? And that's really bad for the joint. So the first time you do this exercise, I'd like for you to do it in front of a mirror so that you can watch the angle of your knee. So as you squat down, make sure you keep that knee in line with your foot. Okay? Same principle with the hips. As you go back, make sure you're sitting back in a chair. Now, you don't have to go really low with this exercise, but the point is to build the stabilization muscles as they go down into your knee. Okay? So 3 sets of 10, and when you can do this easily, I'll have your next challenge ready for you. Now, I've got a couple quick tips for you. If you're already having some mild knee pain and you've had it checked out from your doctor and it's nothing major, there's a couple things you want to try. First thing you want to try is stretching out the muscles, because as these muscles get tight, they pull in the joint, they compress the joint, they create knee pain. So, just a nice simple quad stretch where you pull your foot up behind you, hold for 30 seconds, helps to release these muscles. Now, the second tip I have for you are shoes. It all comes down to the shoes, but in this instance, it's true. The inner soles of the shoes with the cushion and support start to break down after about 6 months, whether they're sitting on the shelf in your house or you're actually wearing them. So you want to check your shoes. If they're more than a year old and you're having some knee pain, get a new pair of shoes. That might do the trick. Now, we've protected your knees, so the second most important thing in your body is your lower back. 80% of the population will have back pain at some point in their lifetime. So we want to really address this issue. Now, with tennis, the tennis swing uses a lot of core strength. So in order to have a more powerful controlled swing and not end up with elbow pain and shoulder pain, you want to bring in all of your core muscles to help support you. Now, for this exercise, we're going to utilize a band. So this basic stretchy band, you can buy it from any store, Target, Walmart, TJ Maxx, any sporting goods stores. You can Google bands on the internet and order one. Should be around $5 or $6 and they'll do the trick. Now for this exercise, you're gonna stand feet shoulder width apart, knees unlocked. It's very important not to lock your knees back because then this transfers all the pressure up into your back. So knees unlocked, quads nice and tight, stomach tight. You're gonna lock out your arms nice and straight, and you're gonna twist. So make sure you have enough tension on the band, and then twist around. Now make sure that your arms move with your body. It shouldn't look like this, okay? So arms nice and tight, moving with your body. You wanna really focus on feeling this exercise in your core, and this is gonna help your stomach protect your back during your swing. Okay, so 10 rotations each side. As it gets easy, step out a little further, increase the tension in the band, and that'll make the exercise harder. Okay, after you finish your trunk rotations for your core, if you feel like your back and stomach are kind of tight, you want to follow that with some rotations, trying to go all the way around and really stretch out your back. Okay, and then switch and go the other direction. This should feel really, really good. Okay, for the third exercise I'm going to give you today, it's going to work your shoulder. Now, this exercise is using your band again. It's going to help protect you from things like tennis elbow, bursitis, shoulder impingement, common tennis injuries, and also just injuries as you age. So what you want to do is make sure the band is really light. So you're going to stand closer than you would think. Okay, nice light resistance, shoulders back and down, really good posture. You want to make sure you have good posture on all the exercises, but especially for this one. So shoulders back and down, chest out, and you're gonna open up your arm to the outside. Now, if you can see the angle here, you're gonna keep a nice 90-degree angle on your shoulder and just open and close. So from the front, looks like this. So you're just bringing your arm out across your body. Now, where you wanna feel this exercise is right in the back of your shoulder. So as you squeeze out, if you feel it in the front, I need you to readjust your posture, focus on the back, so that you're really pulling in all of those good rotator cuff muscles, and we're protecting your shoulder from injury, and we're also gonna give you a more powerful stroke and a powerful backhand. In order to increase the endurance in your shoulder, you wanna be able to do 3 sets of 10. And as it gets easier, just scoot out, increase the tension, make it a little harder. So after you finish this third exercise, if you feel a little bit of tightness in your shoulder, you wanna make sure you stretch it out. Now the best stretch to address this is for the exercise, remember you went out, working the back of your shoulder. So to stretch it, you wanna bring your arm in and gently pull it forward. Now, if you're so tight that you can't grab your arm without hunching and using really bad posture, you wanna make sure you find a fence or a wall, stand up really tall, and then you can push your elbow against the wall. And this is another way if you can't reach it, and gently pull forward. Thank you for your time, and I congratulate you on your new healthy lifestyle, and I'll send you an update on any new videos.